have 14 Frenches, so you want to make sure what French you have. You want to make sure that the packaging is intact, that it's not expired. And then you're going to go in your patient's room. Okay, I want you to be able to explain this procedure to the patient. So I want you already to start thinking about how you're going to explain it to the patient. You're going to walk in your patient's room. You're going to identify yourself. Hi, my name is Chris. I'm going to be your nurse. Always doing PS Love on your way in. We have a side rail down, so we would have to make sure that that's up in the future, but we do have call it within reach. Bed is not locked, or bed is locked. So we're going to identify our patient. I think her wristband is on this side. Nope, it's on the other side. So I try to get on the same side as the wristband if I can. So metatarsal, tell me your name and date of birth. Metatarsal, date of birth is 6/21/1988. 6/21/1988 of metatarsal. So I have the right patient. And then we have to sit down and have a talk with her. So the physician has ordered that you have a Foley catheter inserted. You have a bladder scan greater than 400, which means she's retaining urine. So she may not know what a bladder scanner is, or she may not even remember the aide coming in to do the bladder scan. So just remind her what the bladder scan, that's an ultrasound of your bladder to see how full it is. I know you're probably very uncomfortable. If we're assessing this, that's the other thing we want to make sure that we do. We'll look in the suprapubic area to see if we see any distension in her area. We could also press on it, but that could be pretty painful for her. This would be an area where percussion might help. But again, you already have the bladder scan, so you already know that she's pretty distended. So then you want to reassure her that this might sting a little bit, because it does kind of burn when you're putting the Foley catheter in. Do not tell her it's not going to hurt, because that is a lie.
Exactly.
The guys with the male, they have Urojets. You guys, have you heard of them? It's a lidocaine that they can give to the males, but there's nothing like that for females. So they can kind of numb it for the guys, but they can't numb it for the girls. So you want to just reassure her that you're going to be there with her the whole time. She needs to make sure that she's breathing, and you want to relax as much as possible. She has to be able to follow commands. Now, you're going to have patients of all sizes. So you may have to take 1 or 2 people into the room to hold up the abdominal folds. You're going to need plenty of light, so you may have to bring a light into the room so that you can check to make sure that you can see the proper hole. You guys are nodding your heads. You know exactly what I mean. And sometimes I always warn people that, because they tell me later that I don't warn you guys, but it may smell really bad when you're down in the vaginal area. And that's just because some patients can't actually get to that to wash it. So it's not that they don't want to, it's not that they don't want to take care of themselves, but you know, they're coming to the hospital because they're sick. If they were healthy, they would be able to at least get in the shower and wash. They're not able to, they're not feeling good. So you can wear a mask. Sometimes I have worn a mask and I've put Vicks under my nose so that you know, you're not gagging while you're in there. I mean, it does happen. Even with enemas, same thing. You know, you may gag. So.
Ostomy care, same thing.
Yep, you may gag with that as well. So just be really careful about that. This is one where you really need to position your bed appropriately. One of the things that a student brought into us, and I've been teaching all my students, is that once you've done peri-care, go ahead and wrap their legs in a blanket. That'll keep them warm, it'll help protect your bed, and then put chucks underneath. So that way, if there's any problems, it's not going to soil the bed, and you won't have to change the bed. So just keep that in mind. So once I explain the procedure to her, I make sure she doesn't have any questions. Again, you may have to do this on confused patients. You may have to do this on patients that you're going to have to do it from an odd angle just because of the patient or the condition. So just kind of think of, if this patient was positioned in this way, how would I do it? And then bring that to class on Friday, and we'll kind of work our way through it. Because you're going to find, I know Julie had said that they had a patient on the side. They couldn't turn the patient, so they had to do the best they could from the rear in trying to get the Foley catheter in. Luckily for females, the rectum and the vaginal area are pretty close together, so men, not so lucky. You know, you do the best you can. So once we do that, first thing that needs to be done is peri-care, so I'll have the aide come in, do peri-care, and wrap the legs. I'm going to have somebody over there help me, because you can pre-wrap the legs before you guys come in. I'm going to go ahead and remove this. They must have been pretending last night that she was incontinent or something. So we're going to go ahead and I'm going to do this the long way. And And this is not to restrain your patients at all, it's to keep their legs warm. So what we're gonna do, they should have a leg strap on their leg. We won't need that till the end. We want this underneath the bottom so that we have a nice smooth area. And then spread the legs and wrap this up and over and underneath. So you have a nice smooth area. Let's see if we can't break that leg out just a little bit. Normally what they would have is they would have their legs up, but it doesn't work very well with the mannequins. If you can get them up, that would be great. Go ahead and put their legs up. Just kind of position this. Make sure that it's not going to be in your way. That's really the big thing. So you want to tuck everything in so that it's
Do
nice.
we have to do the blanket part, or is that just a one technique?
Just a
that you
comfortable thing.
It's kind technique for your patient. So it's up to you. Completely up to you.
like? Okay.
So then I would have her there covered up, you know, while I'm getting everything else that I need to get ready. Because you don't want to leave your patient exposed.
Right.
But if you cover them up, just remember before you start, you have to uncover them. Because I had a student who covered everything up and then she got sterile, and guess what?
She couldn't
She
uncover.
contaminated because then she moved the gown up. I had another student who did the same thing, except you have this extra drape thing in your kit. So she used the drape to pull the gown up, so she never contaminated herself. I just reminded her, and she knew at that point, because you're gonna know. Make sure you get the gown up before you start. So you wanna get this at a good position for you. This is one time where I take off anything that I don't need. My hair is back, and your hair has to be back for this procedure. Sterile procedure. If you break the sterile technique at any point in time, you must tell me I broke sterile technique. If you don't, you will lose a lot of points or fail. Because this is, you've heard of Caudy before,
Caudy.
some of you? So this is one
Right.
time where I take my watch off again. This is a sterile thing. I don't want my hair getting in my way. I always have a hair thing on me. Okay, I need a table. Can I have that one? Bring it over here. So again, you don't want to keep your patient covered. Oh, I can bring this down a little bit. But just double check pericare, make sure she's nice and clean. And you want to always reassure your patient. I think so. Just want to bring this up a little bit. Yeah, you're going to need to see this because you're not going to be able to see from over there. So you're going to open up your kit. And there's little arrows to tell you how to open it. You're going to place your kit, believe it or not, on the bed. I know on ATI it's going to show you that they're leaving it on the table. But we are going to show you it in the bed. You want to put this down far enough so that when you put your other kit, and this is going to be underneath the patient's. Over down here. It's okay for us to go over this, but once we open this up, you cannot go over that. Again, it's a sterile field. The only thing I will do is I will move this stuff out of the way. I'm still leave her legs down. But you guys get the idea. Normally their legs would be up. So what I will do, you open a sterile kit how?
Away from you.
Away from you.
Sides.
Is it okay that I touch there? Why?
1 inch.
Side. And this is one where I would hold the side while you're opening up the other side. Now this one should be folded back, but it's not, so I'm going to pinch and bring it down. And you notice how that kind of pulled up a little bit? So I want to make sure that I'm holding that as well. Now if I had this too far up, you could pull this down or pull it up as you needed to. Big thing is you need to get this as flat as you possibly can. Now this part is, I believe it's the drape. So what that drape is going to do is going to drape over her legs and drape in this area. There are two ways that people do this, so I will show you both of them. So obviously I'm going to need to move it. But you guys have to decide what works best for you. You have to try to figure out where it is, which side is opening. So I'm thinking that it's in that spot. I'm going to tape off because I'm going to contaminate. So you want to be able to pick this up because your gloves are right under this. Notice there's a shiny side. So I did grab it in the right spot. Since an inch all the way around is contaminated, I'm just going to grab it here. You don't want, if that were to happen, you just wanna make sure it doesn't touch anything that's contaminated. Alright. So now, what you wanna try to avoid is putting, if you're gonna put it down long ways, which is okay, you wanna make sure that you let go, cause now that corner over there is contaminated. So you wanna be careful about that. But notice the only way that I can put this down like that is, where's my arm?
Over
Oh,
here.
good.
It's over. So what I wanna try to do is I wanna try to get over here, cause again, an inch all the way around is contaminated. So ideally, you're gonna be placing this like this. And you're gonna get that arm out of the way. Now I'm gonna be able to push this down once I have sterile gloves on, so that's okay. The other thing, the other way you can do this, and this is generally the way that I do it, is I put it down like this. And then again, I can reposition that with my sterile glove once I get that on. Any questions about that so far? So you could do it lengthwise, you just gotta make sure you don't go over your sterile field with this dirty hand. So if you're gonna do it lengthways, you wanna make sure you hold it on this side and then put it down. So I'm gonna move this over. Actually, I'm gonna use this as my garbage bag. Now, this was a procedure that I had where a student, he didn't turn his back on his sterile field, but a fly landed on it at this point. So, guess what you would do in real life?
Start over.
You get a whole new kit. So now I need my sterile gloves. Now these may or may not fit some of you, so you have to just figure that out. And if they don't fit you, remember you have a pair of sterile gloves in your bag still. So I'm opening up further away than closest to me. I'm just gonna make this work, but you're gonna see what happens when your gloves are too big, because these are gonna be too big for me. Remember your table is waist level or higher. Sterile gloves, so I'm gonna pick it up by the cuff first. Stand back. I'm gonna put this on. Now what happens if my fingers didn't go in the right spot?
Just leave it like there until you feel normal.
Okay, I'm holding onto the wrapper so that it doesn't move while I'm putting on my other one. I'm going underneath the cuff, up and away. Now watch those fingers, because you wanna make sure that you don't have them hit you, and notice my thumb is up and out of the way, and my fingers are protected underneath here. So now I can let go, and I'm ready to start. Now in the video, ATI video, they do show opening this up. A lot of facilities don't necessarily have you open this up, but they'll have you put it like here. That's that extra little thing that she used to move the gown up and away. So now I can touch in here and reposition this. If this were to close on itself, contaminated. So you have to say that. If at any point you contaminate, you want to make sure you're saying that. So what I'm going to do is I'm going to position my kit, bringing this up here a little bit closer. We're going to separate things. One of the things I will do is I will separate all my cotton balls, because they have a tendency to stick together, and then when you go to grab them, guess what? You can't. I will open up my iodine. We are not really opening up our iodine. We're just going to pretend. Go ahead and pour that on there, and then this will go in the trash. I will take my sterile saline. This is the lubricant, so you're just going to tell me that you're going to open this up. We don't really use the lubricant on the mannequin because it tends to cake inside of them, and then you can't get anything in them. So we're going to put the lubricant here. Drop. Don't be nice and try to put it in here, because guess what? You're going to start touching the inside of that. You're going to contaminate. The other thing I will do is I will take off this cap, pull back first to break the suction. If you don't and you try to push it forward, you're going to get some saline to come out of this, sterile water actually. So I will take that out first. There's a little bubble in here, but I'm not going to worry about it. But you want to get that air out. So I will take this and I'll go ahead and I will attach it to my Foley. I try to keep this in the kit as much as possible. Some instructors will go ahead and they will take this out even, but I don't. I leave it in the bag, in the box, because it's protected that way. This is where I will lubricate my tip, and then you're going to go ahead and insert this on your Foley cap. And it does matter how you position this in here, because when you're taking this out, you want to be able to go straight in. So make sure that as you're positioning this in here, you can just pick it up and put it straight in, because you're going to be contaminating here now at this point. You should also, oh, we don't have the sterile cups in here anymore. Oh, that's good to know. Some of them, oh yeah, here it is. you'll have a sterile cup. If you're getting a specimen, you can